Welcome back, Loveaholics, to Confessions of a Loveaholic. I am your host, Emmy Hernandez, and I have a very special guest with me today. No, I mean it. I know you're going to say, Emmy, you say everyone's a special guest. Yes, they are. However, this episode is very, very vulnerable to me because a lot of you don't know this, but I have been on a very crazy medical leave for 9 months. I had something super crazy happen, and my life has not been the same, but I am now getting much, much better thanks to the person I'm going to introduce you to today. Her name is Amy, not Emmy, Amy Vander Linden. I'm Emmy. I tell you, she has been absolutely life changing for me. And you're going to get to know more about her throughout this entire episode. I'm going to tell you all the nitty gritty. Today's going to be a TMI episode, okay? Just heads up. It is TMI. You're going to hear all the things that happen to me in my body, whether you want to or not, all in the name of helping others heal. Okay. I'm sharing all the nitty-gritty details because I want others to know that they are safe, and Amy has made me feel safe, and it has completely changed the game. Let me tell you a little bit about Amy's background. Amy has been a physical therapist for more than 20 years and specializes in the John F. Barnes myofascial release. We're going to go into those details here soon. Amy has found this to be the most effective way of eliminating pain, restrictions, and restoring mobility. So let me tell you what that means, okay? Amy is an expert in the pelvic floor. What do you call it? The bowl? Would you
Yeah,
say?
pelvic floor physical therapy. Yeah.
Perfect. So I have to tell you, before I came to Amy, I was watching a whole bunch of YouTube videos and I thought I knew what I was watching. And I got to tell you, I was doing way more harm to myself by just watching random YouTube videos because I hadn't gone to an expert. So anyway, we are now going to go into the details. Amy, thank you so much for being on our show today.
Oh, it's so my pleasure. I miss doing podcasts and you're an absolute sweetheart and I'm beyond honored to have any role in your healing journey.
Thank you so much. Truly, this has been, and feel free to share with the audience. I'm going to tell them a little bit more about how I ended up in your office. Like day one, I was hunched over in so much pain. I think by the time I walked into your office, I think I almost fainted when I sat in the chair. And
You're pretty white. Yeah.
yeah, it was a scary day. It had been the first time I had driven in like 7 days because I had spent 7 days in bed. And yeah, so that was that was 7 days in bed. And this was just, we're talking about 3 weeks ago. So to give y'all a little bit of context, on May 21st, I woke up with severe, severe pain in my lower abdomen, and I didn't know what was going on. And I've suffered with digestive issues my entire life. So I was just kind of in the mode of suck it up, buttercup. It'll go away. Something's going on. It'll process. Just keep doing life. Well, it didn't stop. 2 weeks later, I finally went to the ER. My husband took me to the ER. They gave me a CT scan. It came back completely clean. And I asked for an ultrasound, and they're like, no, it's not going to show us anything else. So be on your way. I begged, I cried for about 45 minutes, and they said, sorry. So I went on my way thinking I was a crazy person. So 2 weeks later, I'm still doubled over in pain at this point. I can't eat, I can't sleep, I can't drink anything. And the pain was getting severely worse. And by this point, I had lost most of my cognitive function. So, for those of you who have never experienced this, when you're in that level of pain, so by now we're talking 30 days straight, okay? 30 days of this level of pain, I couldn't think. And I know this sounds kind of silly or ridiculous, but the best way I can describe it is, if anybody's ever watched the TED Talk from the lady that talks about a stroke of insight, where she's a neuroscientist and she had a stroke, and she actually talks about how she was fascinated while she was having the stroke because she could see things happening and like things like getting messed up and broken. That's what happened to me. I could literally feel my synapses dying. I could feel myself getting dumber and dumber and dumber. And by the time the 30-day mark kind of rolled around with this level of pain, I had already been suicidal for about 2 weeks. Okay. I was at the point where I didn't know if I wanted to exist on the planet anymore, because if this was what existence was, I did not want to participate in life. And for those of you who are on here, you know the level of relationship I have with my husband. I'm absolutely obsessed with him. He's obsessed with me. And I'm going to tell you, the only thing that kept me on this planet was the fear of how much I would miss my husband. That's the only reason I didn't attempt anything, because I didn't want to lose him. And I gotta tell you, this is very vulnerable and it's super crazy, but I want you to know the level of pain that I was in, because that'll help you understand sort of like the fast forward to where I'm at now and why I'm so grateful to Amy. So on June 19th, I had emergency surgery at Mayo Clinic. And I'm so grateful for those surgeons. By the time I went in there, my body was going into sepsis. What they found in the surgery was that I had a fibroid that had grown on my uterus, and it had a stalk on it, which is very rare, and it had twisted on itself. So because it had twisted on itself, it wasn't getting any blood flow, and therefore it was restricting my movement, and it was causing me to be doubled over in pain, and it started to create for the other organs to go into shutdown as well. So that's where I was. And they said, okay, surgery's done. You should be up and running. No heavy lifting for six weeks. That was the only restrictions. No pool for 6 weeks. And you should feel better in about 3 or 4 days. Well, fast forward, I'm not going to torture you through the last 9 months, but that was June 19th, 2024. We are now recording this in March 2025. And I can tell you that I have not been okay since then. The pain continued almost exactly the same, because I spent so much time in this super tight area. So this is where Amy's gonna go tell us like what actually happened post this, right? So like in the fascia and all those details from her expertise. But I wanted to give you some background so you would know like, oh my goodness, this was a lot. So I share all of this because I'm now understanding a little bit more around what happened to my body and the tightness and the medical trauma that happened um, while I was going through this. And by the way, none of this was the doctor's faults. They all did an incredible job. They just didn't know how to help me post surgery. And that's okay. It's just not their area of expertise, but I was able to find Amy. So I'm going to pause there because I would like for you to hear from Amy's perspective what she saw in the assessment and what she realized she needed to do to help me moving forward.
Well, thank you. So that was a really tiny snapshot, you guys, considering what those 9 months, there were many trips back to the ER, many more requests for ultrasounds, lots of tests blood work, ultrasounds, you had a colonoscopy too, didn't you at one point? What other tests did they do?
Not during this one. They did the vaginal ultrasound, which
Right?
45 minutes of torture. I was biting down on a towel for 45 minutes. Yeah, they did. I had two endoscopies, but a long time ago, not during this testing.
Okay. So other testing with ultrasounds and the vaginal ultrasound and things, but bottom line was they weren't finding anything. So like she said, they tried, but they were pretty baffled at the fact that fixing the surgery didn't fix her symptoms. So guys, Emmy is blowing me up to be this miracle worker, and I do feel like God has given me a specific calling, and I love letting him use my hands for stuff, but I don't have a crystal ball and I did not do any magic on Emmy. The thing with your fascia is that it's our connective tissue head to toe. It's continuous. If you want to think of it like a web, all of our cells, all of our bones are even just very highly mineralized fascia, our nerves go through there, our blood vessels go through there, our lymph vessels go through there, our organs sit in all of that. And so I was trained in myofascial work starting back in 2009. So I started doing that work far before I started specializing in pelvic. Did you end up just finding me on Google?
Yeah, you were just Google. I actually looked up, so for those of you who have either had this or thought about it, my pain was so severe, literally like on a 24/7 basis, that I was actually looking up the symptoms for uterine prolapse. So I wasn't sure if my uterus has had prolapse. So I literally Googled prolapsed uterus Phoenix because I'm in the Phoenix area. I was like, whatever pops up, and that's how I found you.
Oh, wow. Okay. I don't even think I asked you that at the eval. I think you just said Google and I said, okay. Um, Thankfully she does not have a prolapse. Um, so our nerves and everything flow through there. And so our fascia can create up to 2,000 pounds per square inch of pressure when there's torque into the system, when there's even inflammation, rather than our tissues being slidey glidey and our tissues being hydrated and our bodies having lots of nourishment and fluidity in them, things can become more gunky and stuck. And lots of pain sensitive structures have to go through there. And so when there's surgery, you additionally have a scar, of course, even when it's small, even if it's endoscopic, whatever. And that causes that fluidity to fragment somewhat. So when Emmy came in, she was not walking well. She had trouble sitting. Um, we had a conversation. Um, she was filling me in on this very extensive medical history. And thankfully, we did the discovery session first, right?
We did, yes.
Yeah. So thankfully, we've gotten a lot of the history. That's something we offer as like a consultation so that clients can find out more about what we even do because they don't know, which is completely fine. And I'm super glad in her case because that 30 plus minute conversation, I was able to get a really good picture of all of the things that she'd been through again these last 9, 10 months. Whereas that didn't end up taking 30 to 40 minutes of her evaluation time. And we do usually schedule a 90-minute evaluation. So most of that was able to be spent hands-on. And I literally will do a thing sometimes where I can press on the top of the head. We call it general listening and get a sense for pull or tension down through the body. I'll check pelvic alignment. You know, we have our two sides, but they can shift up, down, they can shift front, back, and rotationally. So just again, looking for asymmetry. So I specialize in pelvic health, but I always assess and treat the whole body. Not in the same way that you get a full body massage, but in the looking for those lines of tension, trying to get to the root cause of what's pulling on those pain sensitive structures. A lot of times where we have symptoms isn't where the core restriction is. Our bodies are extraordinary at compensating and shifting and trying to help and put slack and make up. And next thing you know, we're like this twisted pretzel, right? So I think it's really important that we look at all of those pieces. And so the actual fascial work, oftentimes clients are like, what are you doing? Because it starts off so slow and gentle, and I'm literally sinking in. So if I'm remembering correctly, Emmy, feel free to correct me because it probably stands out even more to you. I think I went to put my hand on your stomach and you kind of flinched and I waited and we had to start off body.
Yes, it
Yeah.
was
So
so crazy. Like you literally barely put your hand on my stomach, and we're talking like feather light. And my body went into like panic mode, and I started bawling. And I told her, "I'm so sorry. I'm just so scared."
yeah. So that doesn't always happen. And I know off body can sound super woo-woo and make of it what you will. But we are energetic beings, and that energy, I don't even consider myself, we have a staff member here named Teresa who does emotion code, body code, Reiki. She is extremely more intuitive than I am. But Emmy's nervous system, it was so obvious, right? And so I often will start with more of the hands-on structural, but I mean, she literally flinched, you guys. So I came off, kind of started above her and like dropped into where I was like, okay, I was like, do you feel me here? And I was probably 6 to 8 inches off. And she could. And I was just talking to her. I said, just breathe. I said, you're in charge. We have safety words of halt or ease up. So I just had her breathe. I just had her settle. I said, feel your body on the table. You know, we tend to just whoop and we're gone, right? We're out of our bodies, which again sounds super woo-woo. Make of it what you want, but that's how it works. Sometimes if we're even sitting in a room or you've been in a massage, but you're thinking about the errands you have to run on the way home, that to some degree is being out of your body. You are not fully aware. You're not fully present. So very, very quickly, in a matter of 5-ish minutes, I would say, she was able to let my hand settle onto her stomach. And I just reminded her that we would stop anytime she needed me to, that we would adjust, that this is how all of the work goes anywhere on the body, whether it's internal pelvic floor work, rectal work, on the back, on your neck, all of it. If there's alarms going off for any reason, not even just pain, we encourage clients to speak up, like let's hit the pause button and we can sort out what's going on. Your nervous system is keeping you alive and it's keeping you safe. And so if it's sending some funky messages, it's important to honor that and figure out what's going on. Emmy wanted me to for sure show you the Do you have anything to add about that beginning session? We've only done 3, right?
We've only done 2.
2, your eval and 1 follow-up, right?
Yeah.
So
We've only
wild.
done 2.
Okay.
And this
Yeah,
is,
she's not been coming here for 9 months, you guys. She's not been coming here for 9 visits. We've done 2 visits. So again,
yes.
these results are not typical.
No.
Let
And
me also say that disclaimer. But she wanted me to show you the pelvis
yes,
because, and
please.
this is just a bony, and then the red are all the muscles. But even this obturator guy here is such a big deal. This is your hip socket right here. That concave, that's where the head of the femur goes. That's weird to do in reverse on the camera. But and this muscle actually comes down through here and attaches to the femur. And so our hips, our low back, all of that is connected. And we have 3 layers of pelvic floor muscle. This is the bowl part, that's the deepest layer. Layers 1 and 2 really make up the vaginal canal. Externally, we have the perineum, the band that goes between our sit bones and between the vaginal and rectal opening. Men have it too. For them, it's between the testicles and the anus. And so this tissue, even of itself, contributes to a lot of pain, discomfort, tension throughout the pelvic floor. And so even when we're going to do internal work, I start with the perineum and it should just kind of give like a band like this, have some pliability, not be sharp, painful. You know, oftentimes clients will say it feels pinchy or stinging. And so that's not normal tissue response. It should just feel like pressure, just like if I touched your arm, that's going to feel like pressure. It's not going to feel like nothing, but it shouldn't be painful, stinging, achy, raw, sharp, any of those kinds of things. And so we just started with the external work at first on her low back, her sacrum, her belly, mostly the belly. Because of her long-standing history with digestive issues, I think that's not a very well-known fact either. I talk to clients all day, every day about their peeing and their pooping because constipation has such a profound impact on our pelvic floor. Digestion in general does. And their simpatico, right? So pelvic floor dysfunction can cause digestive issues, but I think more often digestive issues contribute to pelvic floor dysfunction. So we do a lot of conversations around that and nutrition and inflammation overall, because that can be such an important factor. So that first session was primarily getting her safe in her body, coming up with a home program, being able to work on her belly, giving her a ball so she could self-treat her belly at home, and then some of the pelvic floor work. So why don't you tell them a little bit more, like, what were your expectations? I don't think I really even asked you this. What were your expectations when you came in, Emmy? Like, what did you even think, even for the discovery session? Like, what did you even think pelvic floor therapy was, or what were you even hoping I might be able to do for you?
Yeah, so this is actually a really good question because I don't even think I had really thought about that. But my only reference point to physical therapy was seeing my husband go through 6 weeks of physical therapy after he had rotator cuff surgery.
Mm.
So in my mind, it was just exercising and stretching. Like I was just like, it's exercising and stretching. And that was the only reference point I had. I had seen my husband do some of that at home and some of the sessions there. But at the point that he was doing it, it was just more of creating mobility in his arm. There was no longer any pain, right? He didn't really have any pain involved. So he finished the program very quickly and he was just kind of done with it. So I thought it was just going to be a little bit more of like, I honestly didn't even think that you were gonna like have the table that you have, or you were very hands-on. And here's why. I've spent the last, 9 months at all these doctors' offices, and I gotta tell you, they quote unquote touched me with the speculum probably a few times, but their hands or their gloves to like my body in those 9 months after all those ER visits, they probably only touched me 3 times total just to check to see where the pain was. And then they were done. They were hands off. And so I wasn't sure what it was going to be like with you. I knew I was frustrated with that because I wanted to like tell them like, no, it's here. Like I want to show you where the pain is and like, can you do something? And their only solution was to pop me full of muscle relaxers, which would only work for me for maybe 15 minutes. Right. So like I didn't really know what to expect other than the fact that I was just desperate with what wasn't working. I had no idea that you were going to be so hands-on and so like let's call it intimate with those muscles. Because I got to tell you, on top of all the pain that I was having, like I was not able to be sexually intimate with my husband. And thankfully I have an amazing husband, right? So there was our relationship is not in jeopardy, but I want to have hot sex with my husband again. Like we had hot sex for most of our relationship. And it was like, oh my God, it got to the point, ladies, where I was terrified of having an orgasm. If I would have a clitoral orgasm like that was stimulated through the external areas, it would be like 1 second of pleasure, if that, and then I would go into massive pain. So imagine being terrified of going into that level of pleasure. So like I didn't know what to expect when I came with you. And actually, I want the audience to know this. The main reason I came to you was because of your video on your website when you're like, hey, there's no such thing as TMI here. We can talk about what's going on with sex and if that's painful, what's going on with poop, what's going on with peeing, like all of that. And I knew that I was going to be safe with you because you understood that. And I have to tell you, in these 9 months, every time I told any of my doctors that I couldn't have sex, that it was painful, even if my husband, like any level of penetration, like whatsoever, period, they dismissed that as if it didn't matter or if I was crazy. And that was making me feel like I was crazy or that didn't matter. So you making me feel safe and being able to share that and you telling me that no, that's not normal, we could work on it. And then you showing me the pelvic um the actual demonstration of the muscles in there. And as silly as it sounds, ladies, I didn't know, like we see the bones and we see the skeleton and all that. I didn't know all those muscles were in there. Not only did I not know all those muscles were inside there, I didn't know they were connected, as silly as it sounds, to the rest of my body. So I can tell you, because of the session I had with Amy, I've made tremendous progress because I started going to Korean yoga to start working specifically on my hamstrings and my kidney meridians and a lot of other areas. So I did learn how to stretch properly, but in a way that helped my body flow and not actually hurting it from like, bro stretches at the gym kind of thing. So, but like it was a
Well,
combination with that my brain finally said, oh, I get it now.
well, and
Release.
just so you know, I mean, and everybody listening, most people have no idea that we have layers of muscle in there, male or female. Nobody knows that. We're not taught that. I mean, I went to grad school at Boston University, and with our initial anatomy and physiology class, which was extremely extensive, we weren't really taught about the internal, deeper pelvic floor muscles. And so it wasn't until I got specialized training in pelvic health that I learned all about that. And so that's one of the most common things that we end up talking about. I have a lot of video content on our YouTube channel because we don't know and we aren't taught that there's pelvic floor muscles in there. They affect our hips and our low back, and that they go from the sacrum and they're underneath the glutes and all the things, right? And my favorite topic is helping women have better sex. And so when she was saying that because I have a lot of clients that have pain with penetration, and that's one set of muscles and area and issues. But a lot of those women don't necessarily have issues with climax and or clitoral orgasms. And so when Emmy was saying that the spasm from the orgasm created hours and hours of pain, obviously that's additionally concerning, because now we've got a couple sets of things that have to get better for that to change. I do feel 100% that a huge part of why you made such a big leap with your first session and now even your second is because you are so body aware and so self-aware, and you did have a lot of those breathing and yoga and Tai Chi type tools at your disposal and within your awareness already, that often I have to sometimes teach clients those. I have to teach them how to breathe well. I have to teach them how to connect to those muscles and slow down. And you already have a mindfulness practice and some things that helped you, I think, make more of a quantum leap when you did connect some of those anatomy dots. You could immediately sort of drop in and pay attention to those areas. That doesn't always come so easy to everybody, which is fine. Like that's part of what we treat and teach about here. But I just wanted to say that because, again, your results to have been so severe and to be so much better in 2 visits isn't super common. It happens, but it's not super common. And I think that's a huge part of why, and a testament to the value of those practices and your discipline in that area. It's part of why when we open this space, we have a yoga studio here. It's not because I'm an awesome yogi. I'm definitely not an instructor. It's because I know we need to slow down. I know we need to breathe well. I know we need to get more self-aware and learn about the healing power within our own bodies. And I feel like yoga does a good job of that. I feel like yoga does really well with teaching good breathing and helping us to just stop and feel. And we don't really want to do that in our world today. We want quick, quick, quick. We want a pill. We want a surgery. We want an answer. We want one stretch that solves the world. Like, and I'm like that too. Like, I'd rather go fast. And so again, the value of yoga, it's why we have a studio here, is to slow down and to know that we really do have answers inside. We really do know, and we really can feel, and that is ultimately the best path to healing. So props to you for already having a lot of those practices in place.
Thank you. I appreciate that. That has also, as you know, been part of my healing journey and learning how to breathe. It was not something that was like, oh, this sounds cool. It's been a survival mechanism, right? And I think you told me in our first session, you're like, you're a really good breather. I don't even know what I was doing. I was just trying not to panic. No, but I was very conscious about not going into panic breathing because I could have fainted on your table that first session.
Oh.
But because to your point, well, first, props to you for making me feel safe, right? Because you were physically touching my body, physically touching the part of my body that I was told most of my life, don't let anybody touch that, including yourself, right? There's a lot of religious trauma there. So
Oh man.
like it was one of those things of like, okay, what's going on here? And knowing and anticipating the pain, right? So there was a lot of that, but thank you for recognizing that. Yeah, that was, so you created the safety for me to be able to go into the breathing and the inhaling and the proper exhaling. And you also said something to me in the last session that was very powerful because you said, make sure you're breathing to process it, not to push it away. Do you want to talk a little bit about that?
Sure. And I mean, it's come up. I had 2 clients earlier today that are both dealing with some chronic issues and frustrated and are both go-getters. They're in their early 50s and very frustrated at feeling limited when they're both so active and health oriented. And I was explaining to both of them today, your brain doesn't care about joy or happiness. It wants to keep you alive and it wants to be on autopilot because that's efficient. And so when we're trying to heal and change how we feel, what we feel, what's going on, it takes mental energy and physical energy to pay attention to what's new. Because our brain will just go on autopilot, even if that autopilot's negative. Even if we are just like, oh crap, my back hurts, I better walk like this and not like this, our brain will just default, right? And so we have to create a new baseline, a new default mode that's better. And that, again, takes a lot of conscious effort. So, what I'd said to her, and I'm trying to remember where I got it from, but well, just from myofascial training, a lot of times when we breathe, right, there's good breathing, right? And we inhale. And it's good to center us, to ground us, to bring us back inward. But sometimes we're almost breathing like you do when you're in labor, right? We're breathing to control. We're breathing to control the pain. We're breathing to control what we feel. We're breathing to try to stabilize, regulate, whatever other words you want to give it, when really we just need to feel the yuck and the shit and possibly the crying or the screaming, or you can't just breathe it down. I sometimes say you can't just, no, I'm okay. No, I'm okay. I've got this. It'll be okay. It'll be over soon. And so sometimes we're breathing like that, where it's like trying to just mitigate what's actually happening instead of just feeling the yuck.
Thank you so much for sharing that, Amy, because I got to tell you, like, part of what makes me feel so safe with you and why I love our sessions is that what you are talking to me while we're in session, right? So it feels very much like a safe space, and you're as you can sense when my body is going into like the auto jerking or the auto sort of like trying to correct and like posture, right? And then sort of like helping me with affirmations and also giving me the power of like, this is my session. I'm in control, right? We could stop at any time. And so being able to have those affirmations and being able to have that empowerment to speak up. And also, you know, what helped me so much was on the very first session where you explained to me the difference between um, uh, like touch, pressure, stinging, dull ache, like, and it'd be great if you can share that with the audience, because you nailed it when I was like, my body's like, you touch me, and it's like DEFCON 5. Like,
Yeah. And everybody gets that analogy, right? Although I did recently learn military people don't come at me. Apparently, DEFCON 5 is actually not a bad alert state. But anyway, you get the analogy of DEFCON 5. But yes, so again, that brain being on autopilot, it doesn't look at the gray, right? It's just automatically goes into DEFCON 5 or whatever the correct term is. I need to figure that out. But alert, high alert, the alarms go off, right? And it doesn't send a baby alarm for a paper cut and a huge alarm for a stab wound, right? It loses that differentiation and subtlety. And so a lot of times, again, as we're healing, we need to get that back. We need to have that conversation. I talk to my pregnant clients about that a lot too. It's like, don't forget that as you go into labor, there's part of your nervous system, part of your brain that's going to want to just freak out. It's like, remind yourself what's just a lot of uncomfortable pressure. And so it's not that we're trying to lie to ourselves. It's not that we're trying to trick our brains. It's just getting the gray back, getting the subtlety and the nuance back of, like, again, like I said, with the arm, it's not going to feel like nothing down there if your tissues are healthy. It's going to feel like pressure. Something's pushing on it, but it shouldn't feel raw. But it shouldn't feel painful. But again, getting that, like, okay, this isn't I have a lot of clients that have been through surgeries, and there could be part of your nervous system that's still under anesthesia, under the knife. And so sometimes I'll even, when I can tell my clients are sort of shifting into some fight or flight, I'll have them say out loud to themselves, this isn't surgery, or this isn't delivery. This isn't my rape. This isn't the car accident. This isn't the doctor's office. This is new. Like, hold on a minute, brain. Like, let this experience be new. What am I feeling? And I'll just wait. I won't move or push harder or go further. I'll just give them a second to feel what they actually feel. And they'll be like, okay, that's pressure. I'm like, all right, let me know if it goes to ache or sting. But then again, it's like, let's get that sting back and realize it's not stabbing pain, it's a sting. And then again, like, not lying, not tricking ourselves, acknowledge the sting, but it's not surgery and it's not stabbing pain. And it's actually like a 4 out of 10, not what my brain first told me that it was a 10 out of 10. And so yeah, it's a process to get that back, especially when we've experienced pain for a long time. And honestly, in the land of chronic pain, anything past a few weeks, especially, intermittent pain, like you've got a headache or neck pain or a little bit of a tweak at the gym that's more than workout soreness, but not a full-blown injury that kind of comes and goes and is nagging at you like a tendonitis or something, that won't necessarily create really significant cognitive or not cognitive changes like stroke, but like differences in how you process and what you're perceiving. But much longer than that, or especially when it starts to spiral into severe pain, spiral into unanswered questions, like when you finally go get checked and still don't get any answers, that's going to escalate. Obviously, your body and your brain's perception of the severity of the situation. It's like, oh shit, nobody knows what this is. It's not just I've been avoiding the doctor for a month. It's, oh crap, I went and we still don't have an answer. I still don't have relief. That escalates things in your nervous system, understandably. So, someone that suffered for 9 months, that's going to be a little bit of a different scenario to wind down, which again, it's so remarkable. You've made so much progress in 2 sessions.
Thank you. And, again,
Excuse me.
props to you for being able to create that safe space. Like it really, I think it takes a special kind of person to be able to create that safe, sacred space because it's very vulnerable. It's very, very vulnerable. And it's very different than the medical, like speculum didn't feel like that at all. And, from session one where my body went into like, I don't want to do this, but I'm trusting you to session two where it was like, I had like everything just felt like tiny bit of pressure with just like, oh, and it felt a little bit of stinging in one area. It was like, oh my God, like this is incredible, right? And you also have an incredible home program that you created for me. Do you want to tell the audience a little bit about the pelvic wand?
Sure. And again, Emmy was super quick to order hers and get it and start using it. And again, I think a testament to her commitment and some of the speed of her progress. We don't necessarily, where is my wand? It's in the drawer. I can grab it. We don't necessarily recommend that to everybody. But again, she had so much tightness and she'd been suffering for so long. And one of her main concerns and complaints, as she shared already, was getting back to pleasurable sex and being able to connect with her husband and enjoy that intimacy. And so I knew the wand would probably be a long-term tool for her. And so typically, even forget the wand for a minute. This my room's kind of a little bit of a mess. I didn't clean up after my last client, but I just have a massage table in here, you guys. The office here, we've got bedroom carpeting on the floor. It's not a PT clinic. I don't have any. We can't go out into the gym area and go to the weights and the treadmills and all the balance boards and the stretch bands and stuff. I have stretch bands here that I send home with clients. We have different tools and things, but primarily we focus on what you need to do here, the manual therapy that you can't do to and for yourself. And then the home program, we make sure that you're confident with it. We do enough here. Like I work with CrossFitters or people that love Orange Theory or runners. Like it's not that I love weightlifting. I highly encourage clients to be in the gym and be active. It's just I don't focus on that part of the therapy here. We have a barbell, we have a set of dumbbells. We do enough so that you feel confident with your home program or confident of what to do at the gym or in your class or whatever your workout situation is. But I send you videos to home. And so that gets emailed to you. Any visit we add or change something, you get an email and videos. And so that's kind of how we like to do that part of the treatment plan and the recovery. And we do have videos. There's really a ton of crazy stuff on YouTube everywhere from me talking about sex and showing you a model of a clitoris to me on the toilet talking about squatty potties to pregnancy, postpartum, my previous podcast, all kinds of stuff's on our YouTube channel, but including the wand activities. So I think that, you know, that also gave Emmy that opportunity. I like to use the analogy, and I think I did with you. If you have a splinter in your finger and you've got to take a needle and you're looking and you're like, okay, I'm going to get the splinter out. Okay, that's not too sharp. Okay. Or someone else is using a needle to get the splinter out. Think of your level of anxiety or nervousness about that situation. It's kind of the same with the wand. It's really nice for you in the privacy of your own space. Bathtub's great, bed's fine, to just relax and recline and even have that contact to be able to ease into the muscle and to use some of your self-dialogue stuff we talk about. Like sometimes I'll give clients messages or tell them whatever safety piece they need of like, okay, brain, let this be new, or like, this is just pressure, not sharp. All of those pieces to reset that automation for the brain to a better space, much easier to do when you have that wand at home. Again, severe restrictions, scar tissue, pain isn't everybody's scenario. Sometimes we're able to just resolve it here and they don't necessarily need a wand as part of their home program. But for Emmy, that was a really big piece and she used it immediately.
I did, and I didn't even know those existed. Like my only concept of anything that would be like
I'm going to grab it.
inserted, yes, please. Mine's in the bedroom, so it's further away. Is anything in the sex shop, right? So like the dildos and stuff like that. And I was like, oh my God, that sounds like terrifying. But this is definitely not pleasurable. It is a tool. You got it? You can show them. Perfect. All right.
So
Explain to
this
them
is
how that
made,
works.
there's a couple companies that sell them. I'm a big fan of Intimate Rose. They have dilators, Kegel weights, which I'm not a fan of. I'm not going into that right now. And the wand. This is one of their newest. And it's longer. They have another one that ends probably about here and is a little less curved. This is their newer one and it's bendable. And I love it because depending on what you're trying to reach and where the soreness is, like somebody too, and depending, sometimes they would tip it to work on those side muscles in the obturator, like I was talking about, and you'd run into your leg as you're trying to angle the wand. And so this, you can very easily just turn the handle up out of your way. It's adjustable. They do make one that heats and cools, and they do make one that vibrates. The vibration one is still not like a vibrator or a dildo. Not that there's anything wrong with those. It's just that vibration for pain is kind of like an ASTEM unit. It will distract your pain receptors. And so for someone in severe pain, it could have some benefit. It's typically not necessary. And so anyway, big fan of their new bendable, changeable one. I know the bigger end might look a little bit scary, but this end is to be the handle and or for rectal work. Don't think smaller, better, because you're not curving this around and poking into your tissues. You're angling, even when I go in with my fingers, I'm angling the sides of my fingers into the tender or tight tissues. And just like that, you are with this tip as well. You're not poking into that painful area with this tip. So even though this end's slightly bigger, I mean, it's not ginormous, but slightly bigger, it's the better end for like nice sustained pressure into those tighter, tender areas.
Yeah, and I gotta tell you, as someone who spent 9 months in pain and was terrified of having an orgasm because it was causing so much pain, as soon as I left Amy's session, I think I ordered it in the parking lot once I got home. Like I was like, I'm not waiting for this, and they delivered it really, really quickly. I think it was like 3 to 5 days or even quicker than that. And I didn't use it right away, but I've only had a chance to use it once. This is the middle, so I'm excited to use
Oh,
it more. I've only used it once, and that was right before our second session. And I made so I all of this, by the way, has all been conversations with my husband. I've told him every single thing that has happened in session with Amy, the affirmation she told me, how she made me feel, like what she did, what she physically did, so that I could understand what was going on and for him to understand part of my healing process, right? So he's like very well involved with all of this because it involves both of us, right? This is a big deal for he doesn't want me to be in pain, and he also can't initiate sex because the anticipation that he's gonna hurt me terrifies him. So he's just like, nope, we're just gonna cuddle. We're just right. So it's like again, our relationship is not in distress, but heck, we want to get that up and running, right? So I created a whole sort of like a setting for myself in the bedroom, and I had some soft music, and it wasn't like sensual, but it was definitely sacred. I created a little ceremony
Very
around
sacred.
it, right? So I had my pillows, like you said, in butterfly mode, and like my knees were gently cradled. And you definitely got to use lube, right? So you have to use safe lube for this. And I was surprised, Amy, because I was like, I'm gonna do this for like 5 minutes and just be done with it, just so I can say that I did it, right? Just sort of like the assignment, because I thought
Such a
I was
good
gonna be
student. Yeah.
right. I just wanted to be a good student, honestly. I didn't know if I was gonna be in so much pain, because the first time that you and I had the session, I was like, right? But I was so impressed that I was able to do this for 45 minutes with zero pain, just being very gentle with myself and just kind of exploring and just kind of like it's a tool. So it was really cool to be able to bend it, and just like me recognizing like, oh, this, I have muscles in here and I can very gently just stretch them, right? Just gentle expansion, gentle expansion. And then the next part was like, well, Amy said that I couldn't do this, but why not run an experiment? I'm like, I'm gonna run an experiment. If after 45 minutes of this level of like expansion, I wanted to see if we were going to see the results. And again, I wasn't expecting any, but I was like, I'm going to use a vibrator to see if I can have clitoral stimulation. And I'll be able to sort of, it was more of like, I wanted to see where I was with that, like an assessment. Like, am I going to go into pain? OMG, what happened was quite the opposite. I had the longest orgasm I've ever had in my entire life, and all of it was pain-free. It didn't come later, didn't like there was no pain involved whatsoever. And that was mind-blowing to me, Amy.
That was so amazing to hear. And the fact that you were like, that was even better than before all of this. And um, I'm not gonna lie to you guys, I don't necessarily have an explanation for that other than the power of us connecting with our own bodies and feeling safe. And I think one upside, I mean, I talk to women all day, every day. I've been married almost 25 years with my husband, 29 years. And I talk to women all the time who aren't that interested for reasons, right? Fill in the blanks for touched out new moms to libido issues, hormone issues, perimenopause, menopause, all of the pain, trauma, surgeries, all kinds of things, horribly painful cycles. But when someone's in a space where they're healed and you had to go without that connection with your husband for so long, to be in that space where you're open, you're feeling much, much better, and to really want to get to that space is pretty much the most optimal environment you can create. Hence, what I believe to be your experiment. Also, side note, you don't have to use the wand for 45 minutes. I usually recommend like 15. But
That's good to
Amy's
know.
an
We haven't talked
overachiever.
about
And
it.
if you guys are her loyal listeners, you already knew that.
I honestly thought it was gonna be 5 minutes, but
Yeah.
it became like I was just kind of like melted into it. It was just kind of like super easy. I was being very slow and very gentle, very intentional about being slow and breathing, because the rest of my life is go, 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 chaos. Go. So I was very intentional about like this is my body needs the complete opposite, right? And to that point, do you want to tell the audience about my new favorite word, and the opposite of that, reverse Kegels? So who needs
Oh,
Kegels and who needs reverse Kegels? Because I had no idea reverse Kegels existed. And I was doing Kegels and some other work on my own that were tightening my pelvic floor, which is the complete fucking opposite of what I needed, but I didn't know that.
yeah. Typically, I'm trying to remember if I've ever had a client not be shocked when I mention reverse Kegels, or if I've ever had a client who knew what the frick I was talking about. I don't think so. Unless I'm talking to like another pelvic PT or something, or someone who's already been getting a lot more known about, I think, in the Instagram influencer world, but probably only in these like small pelvic PT circles. But reverse Kegels are really just expansion instead of that squeeze and lift. And one of my clients earlier today said something similar to what you said at the beginning. She was watching other videos and trying to help her fix herself and made it worse. Excuse me. And so that I unfortunately hear that a lot, which is why I'm like, I'm so grateful there's all these amazing like postpartum recovery workouts online and all of these resources to help women with diastasis or to help if you're leaking pee or all some of the common things that happen. However, I still really encourage women to go get checked by a really good pelvic PT so that you know what's going on with your body. Then use the program to heal and to recover and to strengthen. But if you don't know where you're tight and where you're weak, we have this perception, especially after kids or after a surgery or something where things have not been good for a while. We have this perception that we're stretched out and saggy and flabby, and that's rarely the case. Most of the time, our bodies are trying to compensate and heal and help out, and there's tight areas. And so my philosophy is more like resolve the pain and restrictions, then engage, then strengthen. And so sometimes in that expansion part and the stretching part, reverse Kegels are vital. And so, yeah, instead of inhaling and then doing a Kegel where you squeeze and lift, a reverse Kegel is inhale and then just press a tiny bit like these are the examples I use. It's not classy, but you'll get what I'm saying. If you're going to sneak out a fart in public. So if you're just barely going to push a tiny bit so it'll just eke out and not make a loud sound, does not work if you're sitting on a hard surface, just saying. So don't do this at like church pews or restaurants where it's like hard plastic chairs. Anyway, but you just take a nice deep belly breath and just barely push and then exhale. And it just expands that pelvic floor. Where's my other little circle thing? I didn't get all my props situated. Sorry, guys.
Can I tell them the metaphor that I came up with that made sense for my
Oh, sure. Yeah, yours was great.
Yeah. So when Amy was explaining that to me, like for solid 7 days, she's like, "Did you try your reverse Kegels?" And I was like, "I don't know. Like, how am I supposed to tell if I'm doing it right or whatever? Like, this is very confusing for my brain because I do everything in my power to not release toots, right?" So I was like, "This is like almost 40 years of training, so I don't understand what you mean." And then on our second session, while she had, while we were doing our session, and she had her fingers in the vaginal canal, she's like, "Okay, we're going to practice the reverse Kegels here." And my body's initial instinct is to do the Kegel and the pressure. She's like, "No, it's actually the opposite. Let me show you." Like, breathe in, and then it finally clicked. I was like, "Oh, you want me to push out a tampon?" So that's what it feels like to me, is pushing out a tampon. It's like the breathing in the belly, and then I'm pushing out, not tightening, because my body's instinct and like a lot of my muscles on the outside of my hips, what do you call it? The abductor and I don't know
Yep.
the muscle names. Those like,
Yep.
yeah, they they're just so tight and creating all this tightness and kind of like creating a little tornado inside my pelvic. I call it a tornado inside my pelvic area because everything was kind of pulled in because everything else was creating this tightness. So now I have a better understanding of like, oh, okay, I can release that way. And now I can practice them and it makes sense to me.
Well, and I love that analogy because I do have clients who have trouble sometimes controlling gas. And so, of course, it makes sense that if you have spent a while avoiding farting or avoiding letting that out when you don't want to, you're not going to connect with the imagery of slightly pushing out a fart. So I love the pushing out a tampon. The key, though, is that it's so subtle. So I don't want you bearing down or pushing hard. It's very just inhale, slight press, normal exhale. So yeah, I love my little expandy ball here. Inhale, slight press, exhale. So it's very subtle. If you're sitting on like a squishier surface and you can sort of feel like your labial tissue or your perineum on the bed or couch or something, and you inhale and you just slightly press, you'll feel just a bit of increased contact into the surface that you're sitting on. So that might help as well. But yeah, we do a lot of educating on reverse Kegels because they're often needed at least first.
That's amazing, Amy. This has all been so mind-blowing. Thank you so much for being willing to share your
Well, you're so
expertise.
brave sharing your story. That's so vulnerable. And I'm sure your listeners will value and be glad. Like you said, some of them that have been following you for a while will have noticed your absence and not have had any idea what you've gone through. It's been a lot.
Yeah, it's been 9 months of me basically not having my life. And, I was trying to figure out how to share my story in a way that was contextual as part of the healing. And, we are loveaholics on this show, right? Recovering loveaholics. And as a recovered loveaholic, I want you all to know that the reason I'm bringing up this topic, particularly in sharing my personal journey, is I want you to know this is what I mean about ups and downs in relationships. Like, it has nothing, it has to do with like life is just going to happen, right? And I want you to know that throughout this entire time, I have felt more adored, more cherished, more supported, more loved, more all of it. Like Matt went to go get me, he bought me a walker, right? Because I couldn't walk. Like he would put me on those extra, like the little moving chairs at the stores, like because I couldn't, I was not functional. He does not cook, but he made sure I was perfectly fed. And when I really wanted something, one of my safe foods was like In-N-Out, right? And I also learned about reducing my inflammation. So he would make sure I would get anything and everything needed at the grocery store. Like this man has been by my side day and night while having a full-time job. Okay. So he's in these 9 months, I have, for the first time in my life, not worked since I was 15. Okay. I had my first job when I was 15 and I've been working ever since. So to have to surrender, I'm this strong, independent woman, yes, with an amazing partner, but like, holy moly, right? And he's like, honey, I got us. You're okay. You have one job. Get better, rest, heal. And I would go into like, but I have stuff to do. He's like, yeah, you do have stuff to do. Rest, heal. And I'm like, you don't understand. I'm just spending like 12 hours watching Bones. And he's like, does it make you feel better? I'm like, yeah. He's like, then keep watching Bones. I was like, okay. Right. Like that's that's why I want you to hear this story, because amongst like the chaos, I've been able to come out on the other side with the most true story of what I know now, what I had in theory about what soulmate love is like during this level of physical trauma. And now it's not theory. Like this is real. Like and we're still sort of working through that, right? So to be able to have these conversations and to not, I don't want you to feel embarrassed or scared or like, and if anything like this is happening in your life in any aspect, I want you to be able to reach out to Amy and get a consultation. I highly recommend, even if you're not in the Phoenix area, like, you know what, fly out, because Amy is special. This is not a normal space. Even if you just want to hire her, I don't know if you do virtual consultations or not, but I might be putting that on your radar, because it is life-changing. I think for me, again, it seems simple that you didn't dismiss my concerns, but I was literally being gaslit by some of the best surgeons and doctors in the world in Mayo Clinic. And it's like I I thought I was going crazy. The pain was real, but they were telling me that I shouldn't have any pain. And they were like, "Oh, Emmy, we don't want you in bed. We want you walking around." And I'm like, "I want that too, mother beeper. But don't you understand that it's not working, right?" So they would get frustrated with me for not following a program, but it was a program that I was unable to follow, right? And you created something without pushing me into it, but something that actually works for me and with my needs, and we adjust accordingly. And that's very different than when I experienced before. So this is why I wanted to like bring it all together. Like, this is what it means to be in a healthy soulmate love relationship, and the importance of surrounding yourself with important people that are actually going to be supportive, like you. And when people are gaslighting you, whether it's a partner or whether it's the medical field, run the other direction, because you're not crazy, babe.
Well, and that's a great lesson to like wrap up on because one of our taglines is no settling, no suffering, no shame. And I think it was a long journey for you, longer than anyone would have wished, but at least you didn't stop looking for answers. And I would say to anyone, male or female, yes, women do tend to be more gaslit by medical professionals, minorities even worse. And so if your gut is telling you something's wrong, don't give up. Keep looking for answers. The internet is a scary place, but also you can find more solutions than what are being offered to you. So we say no settling, no suffering, no shame. And I think that no settling piece, when you know something's wrong, just don't give up. Keep finding people that will support you. Keep finding people that will try. I can't help everybody, but that's part of why we do that discovery session. If someone comes in and I'm like, this happened. We have a myofunctional therapist here, not to confuse things, but she works on jaw and airway and teeth alignment. And this client was having headaches, neck issues, even to the point of like, it wasn't just teeth alignment where it's like, oh, you kind of need braces. It was creating airway and swallowing issues. And I was like, that is more critical to your recovery right now so that you can sleep well and eat well, then we can deal with your pelvic stuff later. And so I had her go see Jenny. And so now she's finally coming back to me, I think 3 months later. But, or if I feel like there's something medically wrong, I'm not going to tell you I can help and not. Or I'll say, you know what, we'll know in 3 to 4 visits if this is making enough difference for you to continue. It's not always super clear cut, and I'm not going to pretend that it is. And no provider should really be giving absolutes like that. So, yeah, we've got resources on our website of like the pelvic PT report. Yes, it's geared towards what we do here, but it's also a good resource of look for this in a pelvic provider. Here's some questions to ask them, things like that. We have a bunch of free reports, and we will not spam you. You will get, I think, 2 or 3 total emails. One's just that sending you the report. One's checking to make sure you got it. And then we do like one follow-up call to see if you have any other questions or needs. But there's lots of resources on there. That's momentoftruthpt.com. And then, like I said, there's so much at our YouTube channel, which is just Moment of Truth Physical Therapy. I would love for you guys to follow that, and then you can comment or email me and let me know other topics you'd like me to discuss or hear about or questions to answer. I film content every month. It's one of my favorite days of the whole month, besides treating clients, but I love it. It's fun. We go a little crazy sometimes.
That's perfect, Amy. You already answered my question because I was going to ask where people can contact you. So that's perfect. That's momentoftruthpt.com. We're going to put it in the show notes, and you'll have her email in there. They have a contact form. Her team, by the way, in her office is absolutely amazing. I adore them. I love hanging out and talking to them because they're just the absolute sweetest, and they get you on their schedule as soon as possible. And I'm going to tell you, Amy is really, really busy. Okay. So the sooner you contact her, the better. Amy, as we're wrapping up, I realized I didn't share sort of, because I have a flyer of like all the different things that you help women with. Do you want to do a quick rundown of like, because you do a lot of stuff with we discussed briefly your pregnant clients and like
Sure.
a bit more
Yeah,
about.
I mean, again, women, especially when they're pregnant, are often told, well, there's nothing you could do. The baby's just going to get better. Wait till delivery. And that's not true at all. Even for things as severe as like pubic symphysis pain, which is that pain right at that pubic bone can feel like a knife. Or leaking. They're like, oh, you're just going to get bigger. Diastasis, all of those things. Oh, there's a lot we can do. And again, when you think about the brain and the mindset you want to go into delivery with, we're a huge advocate for doulas. We partner with a lot of midwives here with an amazing birth community in Phoenix. But that headspace of feeling capable, that headspace of knowing what to expect from your body, a lot can happen during delivery. And I think just feeling a bit more prepared, feeling a bit more capable. I love helping women with kind of their headspace around that. Same for postpartum recovery. Women are going through so much, and we focus so much on the delivery, and it's like, well, the journey's really just beginning. But we treat PCOS, endometriosis. I'm really excited about some of the results we're getting with the shockwave with that and being able to control women's inflammation long term and scar tissue long term without surgeries, without them having to just be on birth control and other medications long term. Man, incontinence, leaking pee, poop, men, ED, pelvic floor dysfunction, prostatitis. I mean, pelvic floor dysfunction covers quite a few things, right? But men are gaslit too. And it's like if their prostate's not enlarged or their PSA is not off, they're just given antibiotics and sent on their way. And those tight muscles that none of us know about can be causing pain and causing prostate swelling, but that's not prostate cancer and they're too young for like, or so they'll just get this generic prostatitis um, diagnosis. So I treat men and women. My heart is really for women knowing and feeling confident in their bodies just because there's not many things that help us with that in our world today. But I do treat men and women, and actually babies too, torticollis, lip and tongue tie, digestive issues for those little peanuts. When we work with women during pregnancy, we do a free screening on babies after they show. It's just really my excuse to get some baby snuggles. But yeah, fun stuff.
Thank you so much for sharing because I realize my story is not unique or that special, but it is a little bit more on the rare kind of side. And I know that most of the women that come into your center aren't having, they might have a lot of my symptoms, but not sort of like my backstory. So I don't want for those of you listening thinking that, that's the only thing that Amy does. It just so happens to be that was
Yeah,
my
that makes sense.
story,
Yeah.
right? And because I don't have children, I haven't given birth. I know there are a lot of women out there. I have a lot of friends right now who are pregnant, and those who sometimes are suffering in silence after they've had their baby. I had some have had to have two C-sections, and they're just told they have to like suck it up, buttercup, and the pain will be there forever, basically. And
Not
it's
true.
yeah,
Yeah.
see, so like that's what I mean. Like I want everyone to know like you do not have to suffer, especially not suffer in silence. There are resources. Amy happens to be in Peoria, Arizona, which is in the Phoenix sort of Scottsdale area. So I'm lucky because I get to go see her in person all the time. So if you're in the area, please go see her. Even if you're not in the area, call call her team. Come visit, even if it's just for that. Amy, any final words for our listeners today?
I don't think so. Just trust yourselves, you guys. Again, no settling, no suffering, no shame.
Beautiful. And Loveaholics, we have the same and very similar uh love line here around no settling, no BS, just soulmate love. I love you all so much. We will see you on the next episode.
Thanks for having me.
Bye.